Our laws as it pertains to substances are draconian and bizarre. The psychopaths start this way. He was an alcoholic because of social media and pornography, PTSD, love addiction, fentanyl and heroin. Ridiculous. I'm a doctor, for Christ's sake. Where the hell do you think I learned that? I'm just saying, you go to treatment before you kill people. I am a clinician. I observe things about these chemicals. Let's just deal with what's real. We used to get these calls on Loveline all the time. Educate adolescents and to prevent and to treat. If you have trouble you can't stop and you want help stop it, I can help. I got a lot to say. I got a lot more to say.
Welcome, everyone. I just set up my restream, so I have not seen you there, although I'm seeing hello from Texas now show up on my screen. I see you all well at Clubhouse. We'll be taking questions there after I talk to my guests for a few minutes. Hope you're all doing well today. Happy Friday, everyone. A reminder that next week we have, let's see, on Tuesday, we're going to talk a little bit about a completely unrelated medical syndrome called Lynch syndrome. Dave Dubin has been wanting to come on and talk about that for a little while. And then on Monday, we have Jeremy Murphy. He's back. He has a new book with lots of interesting...
With Paulina.
Paulina's coming in too.
We're going to talk about selling books.
And I think we're going to do a frontal attack on millennials, are we not? Is that what's part of what he's up to?
I guess so.
I think that's part
with
of
a millennial.
Exactly. I wanted somebody there to be able to defend the group. So today the guest is Tracy Beth Høeg, a physician with a PhD in epidemiology and public health, Danish-American with current practice in physical and rehabilitation medicine. She's done published several articles on pediatric vaccinations, school safety, and masks. And we're going to get into that and more. Let's welcome Dr. Høeg.
Thank you so much for having me. It's great to be here.
And let me dare not try to pronounce your name in Danish, but let's have you do it just so you can see how far I am from the actual pronunciation.
All right. Yeah, I think you deserve to give it a try. So it's Høeg, and it means hawk in Danish.
Høeg? No G? Just Høeg?
That was very good.
It looks like it sounds to me like it should be a question mark after it, huh? No?
I guess that is true. Huh? There's an inflection at the end. That's how you when you add the G, that's how it sounds. So
it's so funny. So got a lot to talk about today. I almost want to just sort of ask you what's preoccupying you these days, but let me ask this. You testified in front of Congress about a year ago, right?
Yeah, I've testified 2 times. And the first was about a year ago, and that was related to school reopening policies.
And I read your Twitter thread on that where you laid out just your priorities that you were presenting to them, and they seemed extremely reasonable. They seemed like topics or categories that I've heard discussed a lot lately, like in the last 3 months. The fact that you presented it to them a year ago, did they listen?
I mean, I think that when I presented it at the specific roundtable that I presented at, that people were very receptive to what I was saying. And, I think that it was well established among many people that the harms of keeping schools closed were obvious, were well known, and the benefits of closing schools in terms of COVID-19 were not clear at all. And it didn't seem like keeping schools closed, and we're talking about K through 12 schools, was doing anything to protect either children or adults. And a lot of that was based on, not a lot of that, but some of that was based on the study that I was senior author on that was published in the MMWR, which is the CDC's journal, where we found in January of 2021 that the spread within the schools in a town, and it was actually a kind of a rural area of Wisconsin. Was lower.
Yeah.
Right. It was lower than it was in the surrounding community at a time of very high community spread. And the spread of COVID-19 within the schools was very minimal. It was only 7 students that were infected, and no teachers were infected. And we carried out the study throughout the entire fall of 2020. And it was very similar to what was found in North Carolina as well as in Norway. So we also knew from Scandinavia, even from the spring of 2020, that reopening schools was not associated with an increase in spread of COVID-19 or an increase in mortality, either among teachers or among the populations of those communities where the schools were reopened. So it really became, I guess, something that I started fighting for, that the schools should reopen based on what we knew from the data about COVID-19 and what we know about the consequences to children from having their lives disrupted and from having inadequate access to normal education. And you're right. I testified almost a year ago, and now I think a lot of what we were discussing then has become generally accepted. But there was a lot of reticence within the United States to reopen the schools, and I would say that a lot of it, the CDC was suggesting that school reopening should be based on the amount of COVID-19 spread within the communities, but if one considers that, the spread within the schools was less than in the communities, if children were less likely to catch COVID in school than, at home or being around friends outside in the communities, then there was really no justification for basing it on what the case rates were in the communities, and the schools should have, been allowed to open as they did in Scandinavia in the spring of 2020.
Let me interrupt and point out two things. We're now watching this horror in Ukraine, and as you see the refugees head over to Poland, moms are coming across with their children, and I've seen in interview after interview after interview, the first thing the mom said is his kids have to go to school. I mean, they've been out of school for a week. They have to go to school. We have closed schools for 18 to 24 months. It's an unbelievable harm. I mean, just think about people fleeing war, acknowledging that kids can't stay out of school. We got to get them right, the priority. And yet without any objective data, I mean, none, in fact, contrary to the objective data you just presented, we did untold harms to kids. I mean, think about all the things we demanded kids do that had no basis in objective fact. Masking under age 5. I mean, this was and bizarrely. So my question is, I want to ask what happened to our profession, but I guess I should ask first, what happened to the CDC?
Yeah, I mean, that is a great question, because what we were doing was unprecedented, just like you said, in terms of what's happened in the history of the world. And as a mother, I have 4 children. I mean, it was, at the top of my priorities, to figure out, is it safe for kids to be back in school? And, is it the right thing to keep them closed? And I'm also seeing them deal with the consequences of not being back in school. And so I also wondered, why is it that Europe, is quickly, getting creative, making it happen, reopening schools, kind of making things as safe as possible. And the United States is kind of like really was lagging behind by a lot in terms of what was happening in other high income nations and in terms of reopening the schools. And, I do think that it was multifactorial why. I mean, one of the reasons is the media coverage of COVID-19 in the United States. There has been a lot of misunderstanding and sort of, I guess, what I would consider fear mongering about the risks of COVID-19 to children. There was a lot of sort of fear mongering in the sense of if someone who happened to be a teacher, unfortunately, died from COVID, which obviously happened, a lot of those cases, they caught the disease outside of school. They didn't catch it in school, and yet the media coverage would imply that they got infected at school, even though if you looked closely, they didn't. And so there was impression among the public that schools were not safe to be open, neither for the children or for the teachers, despite what the science said. And second, I think that also the teachers unions played a role. I know that they were, influential in terms of the CDC's decisions to not quickly open up schools in the winter and spring of 2021, once our study and the study from Duke and data from Europe were being published. And so I think that was also a barrier that teachers unions were influential, and the CDC is basically influenced by the politics of whatever the political party is that's in the White House at the time. And I think that's becoming more obvious that that's a barrier to the CDC acting more objectively.
I guess I'm having trouble accepting that because that's just so sad, so pathetic. But whatever. I guess there's no other way to talk about what has happened. They were adulterated in some way, and
right.
And then they also
I love teachers. So yeah, I'm sorry to interrupt.
No, I'm not blaming. Yeah, I'm not blaming anybody. I'm just saying the people that they had in front of the cameras, first of all, did not understand. There's another piece of this that I found just completely mystifying as this all was going through this, is we learned how to shape health behaviors during the HIV epidemic. We figured that out. We knew that we knew categorically you did not demand behaviors from on high. You used humor and music and relatable narratives and stories, and you help people understand the context of the decision they were making. You didn't tell them horror stories, which is all we heard with COVID. I mean, the dumbest and the weirdest question I ever got was when I had a bad case of alpha COVID. People are asking me, "Were you scared?" I thought, why would I be scared? It's a 1% fatality in my age group. When a doctor says you have a 99% probability of, when you tell a patient, Tracy, a 99% probability of recovery, what do you really mean?
I mean that it's good news.
Yeah. When I say that, I mean 100%. I mean 100%, but I'm just leaving a little piece aside to know that it's not really quite 100%. Right, but I'm telling you, you're going to recover. You're going to recover. Relax. And to a 1% fatality rate, I'm going to worry about that. It didn't even cross my mind. And so, my goodness. And we had people so jacked up with bad information. What do they call that? The information effect? I think it was a bias, information bias, that you get the wrong stories or you only get negative stories.
Especially for children, because, their mortality rate is so incredibly low, over 1,000-fold lower than people over 80. And, you look at the data that we have now, especially for children without comorbidities from the entire country of Germany over the first year of the pandemic, there were no children that died that didn't have medical comorbidities. So just, knowing that alone, I think, and the same with the UK, we have their data too. I believe that there were 6 children over the course of the first year of the pandemic that had no medical comorbidities that died. So we have this mortality rate in children that, maybe is 5 to 10 per million, which is, and hospitalization rate of like 1 in 1,000 or 1 in 500, which is even lower now with the Omicron variant. And those. So
let me interrupt you. That is like parents worrying about getting tetralogy of Fallot. Should you be worrying about tetralogy? Should you, Susan? Are you worried about tetralogy of Fallot?
No, what is it? I don't even know what that is.
Has the same incidence as COVID death.
What is it?
Why don't you worry about that? Thank you. It's a genetic disorder of the heart, and it happens about 1 per 100,000, 1 per 10,000. It's more common than deaths from COVID.
But I agree. I wasn't worried about it when I was pregnant.
Right, exactly. I'm looking at the CDC table right now where they have 5 to 17-year-olds as unity, and looking at relative to 5 to 17-year-olds, the risk of death. If you're 75 to 84, it's 3,200 times that of a 5 to 17-year-old. And if you're 85 years or older, it's 8,700 times more likely than and this is the CDC's chart. I'm looking at, people don't believe me. That's a chart. Yes. You can't really see it very well.
I thought that chart was a very important chart too, that a lot of people didn't understand, because COVID is a very serious disease, a very dangerous disease in older people, especially in, nursing homes and long-term care. it's obviously that it's been dangerous for many
Oh.
adults, especially comorbidities, but the
So
lower
you could
risk
help me
to
with
children.
this. You could help me with this. So you're a physical rehab doc. So I'm imagining you interact with advanced ages and nursing homes and hip fractures and
Absolutely.
strokes and blah, blah, blah. Yeah.
Yeah.
So I did a lot of nursing homes in my days, and I could keep people sort of indefinitely suspended in nursing homes, particularly women. And I was looking at some of the data recently, and I found some. You tell me if this data, this is from the a geriatric association. I mean, I should pull it back up again. Make sure I quote who this came from. Oh, shoot. This is a PowerPoint, and I'm screwing it up right as I'm talking to you. That essentially, I'm not going to get it, that the average duration after admission to a nursing home, here it is. This is the Journal of the American Geriatrics Association. This was studying 1,817 nursing home patients who died between 92 and 2006. 53% died within 6 months of placement. So that means that most people are dying like within 6 months. And that sort of fits my experience, that if you're being admitted to a nursing home, why are we not taking this opportunity to talk to people and talk to our family members about whether we ever want to be in a nursing home? Do you want to extend my life 6 months, 12 months with somebody wiping my butt and needing 2 people to turn me, and people like Tracy having to, I don't know what kind of activity you're going to get me into, but for me, I'll take palliative care at home.
Okay, here we go again.
Palliative care at home. Thank you very much.
Oh,
but
boy.
no one's having that conversation.
I can't wait, Tracy.
Instead, it's we gotta.
I can't wait, Tracy.
We gotta protect everybody.
I'm looking forward to that.
Well, anyway.
Yeah.
Hey, listen, I want to talk about something.
That's a very important question. Yeah.
It is an important question, and
unrelated to COVID. And I'll tell you, I specialize in sports and spine medicine, so I don't visit nursing homes, but I see a lot of older patients, and I will say that a commonality is that people value their independence and their well-being, and they want to be active and out, not in pain. And the idea, I think, of going to a nursing home is not something that people want. That's not how they want to end their life, right? And
they go in. I don't know.
I mean, some people have to, but it's not.
We're not talking about going for a rehab after a knee replacement or a hip replacement. We're talking about people who've deteriorated to the point that they need 2 people to turn them.
Right.
They need somebody to feed them. Then
it's like go home, just die, or go to the hospital and die.
Yes. Yeah. Oh, I like that. See what Susan added in there.
You like that?
She didn't want me to die home.
My nursing skills suck,
She
Tracy.
said, "I'm going to the hospital and die."
I'm not looking forward to it. But listen, there's something you guys touched on earlier that I didn't know we were going to be having this conversation today, but about kids and their mental well-being in this crisis. And I had an experience today, and you guys kind of heard it. It's been kind of a drama today. We want to sell our Upper West Side apartment. And it was just about to go out and we were getting some work done, and one of the tech guys broke a little relic in the house, and the woman kind of freaked out. And I said, I just have a bad feeling about putting them under the stress and duress, because they're renters. They're great. They've been great clients for a couple of years. This is a single woman with a 9-year-old in her house, and they made it through COVID. There was no drama. They were never complained. But her son they're getting a house outside of New York City, because it's the Upper West Side, New York City. And he is scared to death of COVID. And he's been vaccinated and had COVID. And he's 9, because you can't get in the building unless you're vaccinated. And he's 9 years old. So I sensed that something was up, and I had to ask a few questions to the people that are there, the concierge and stuff. And they were like, it's just not right to bring more drama into a child's life right now. And I was like, I get it.
Right. I think, it's having young kids myself. I know it's a combination of TV, but also, masking, I think, has created some of this problem, because children are viewing each other as a threat to each other. And, I think that they think, that there's a reason we're wearing these masks, because this disease is dangerous to us. And, that's been one of the things that I've been really careful about is in our house, we watch the news in Denmark, and my kids don't watch the American news, and I've been very clear to them from the beginning that their risk is low. And what they tell me is their friends don't believe them when they say that. And even my son, you guys are in California too, but my 14-year-old, he said they were just able to take their masks off outside during PE for the first time last week. And he said that he and 2 other boys were the only ones that took their masks off because the other ones weren't ready to do it yet. And I'm sure there's many reasons for that, but it is really like, I think there are many psychological effects of asking children to cover their face to protect themselves and others around them for 2 years. I understand why they think it's a dangerous disease to them.
And you know what? I'm a mom, so I'm like, hey, I don't even want to sell. I don't want to bother you guys. Like, I don't want, because you don't want to mess with a mom during a pandemic. Like, I don't want to cause any more drama in my life right now that I need. But the protectiveness of mothers towards their children, some people just want to get their kids vaccinated, and that's great. They feel better. Some people don't, but that's their right. But these kids, they're so brainwashed, it feels like, and it's so hard to. 9-year-olds they're little sponges, they suck in all the feelings in the room, whatever they are.
Well, let's
so you want to have good things in the world.
It is.
Yeah.
Look, every child analyst psychiatrist I talk to are overwhelmed with the anxiety and depression pouring through the doors. Overwhelmed. We had a mental health crisis to begin with. Now we've caused we've just caused a catastrophe as far as I'm concerned, and unnecessarily. There's one thing if it was necessary, it was worked, or it was for good cause or good reason. It was done without a risk-benefit analysis, and it was so obvious it was going to happen, and nobody would listen to the risk-benefit, and no RCT, no randomized controlled trials, things done without any objective basis. In fact, contrary to the objective basis, let's just point again at masking outdoors, which is a level of that's
we didn't see that in New Orleans, though, and I saw a lot of kids out there.
It's an astonishing
smiling.
level of incompetence of the mental health professionals that they would tell you to lock the beaches, lock the horse trail. They filled in the skateboard tracks with sand. They soldered seal over the basketball. The exact places people should have been going. They were prevented from going. Then when they were let back in, it was, you can go to the beach, but don't lie a towel down. You can't lie a towel down. To me, that direction was the single greatest example of the level of incompetence that we were living under. That is disgusting, gross incompetence on the behalf of the people making that policy. Let's call it what it is. And masks outdoors was just another one of those grotesque overreaches, and that had no basis. Literally no basis. In fact, quite the contrary, as you've pointed out. But let's talk about. We talked about what happened to the CDC. What happened to our profession? The first 6 months of this thing was astonishing. What do you think happened?
Well, that's a good question. I want to know specifically what you're talking about in terms of what happened to our profession, because I think probably many things have happened and many things have come to light. But
let me say rather than first of all, I got a front row seat to a lot of this. So I saw a massive difference between our surgical colleagues and our medical colleagues. The surgical colleagues, who have not yet been under the thumb of massive regulation and clinical pathways to every decision they make, because when you're in a surgical space, you have to improvise and make decisions, and nobody can control that. So they're not as used to being under the sway of their employer, local, whatever regulatory agencies are out there. And they immediately started improvising around what could be done to treat this thing. Medical colleagues said, go home, come back when you can't breathe, essentially. I've never seen anything like that, ever. That was disgusting. But what was that?
Yeah, I completely agree with you. And I will say, from just personally being in private practice, that was a great thing for me, that our practice was able to improvise. And from the beginning, I was like, if people need to be seen, they need to be seen. And if they want to be seen in person, we're going to see them in person and make it as safe as possible. And, I think that it's not just our profession, but in terms of like having, doing remote visits and, that we should have been doing more things in person, obviously. And then I think probably one of the biggest things that many people have brought up has been, the issue of people dying alone in the hospital of COVID, and their loved ones not being able to see them, and there being no amount of creativity or sort of leeway, in terms of figuring out how to make that happen. And my husband's a bone marrow transplant physician, and I know that that's been an issue. And I do think that there's a major problem both with physicians not being able to make those decisions and make it happen. And then also just, I think another thing that's come out during this pandemic has been like a sort of a fear of speaking out, and questioning what's being done, in terms of physicians speaking out against things that they think are wrong, because they're afraid either of losing their job or losing their funding. And, I think it's probably even more on social media than in person, but, physicians are being punished for sort of questioning what we're doing, rather than going along with, we must always do the maximum thing to prevent COVID at all times. I mean, it just, even bringing up trade-offs and trying to do a risk-benefit analysis in many, topics has been really controversial, and it shouldn't be. And
it's what we always have done. It's what we are trained to do. Why suddenly, overnight? Unbelievable.
Yeah, and the debate too. I mean, I think you and I both know that that's how people do science. That's how we learn, is by debating each other.
That's how we learn. Absolutely.
A lot of this pandemic has been, people are telling select individuals, I will say, especially in this country, kind of decide what the narrative is, and then it's problematic to question that. And I've been able to see it, how it's playing out in Scandinavia, and it's been different there because there's much more open debate, in the press and among the physicians there, in terms of harm reduction and strategies to reduce harm, and that's been really lacking in this country, I think, and I've been disappointed, I guess, in my fellow physicians, and that's been actually allowed to happen. I think even get worse over the last 2 years.
You have a public health degree. That's where I've seen the real unimaginable behaviors by public health officials, either seemingly not clinically astute, like they didn't have clinical experience and didn't know how to make these kinds of decisions, or really, I just don't get it. There's I thought here's some, for instance, some things they could have done. They could have educated the public how to use telehealth. What is telehealth? Do you don't want to see somebody in person? Okay, we've got telehealth. We've got corticosteroids if you're not doing well. There are O2 monitors you can get at the pharmacy. There are antivirals coming. They still don't know about Paxlovid and molnupiravir. Nobody knows about that. Monoclonal antibodies took 6 months to get that word out, and it wasn't because public health helped me. It was, I'm flabbergasted by the failures.
No, you're right.
And that anybody who did.
Yeah, it should be messages of hope, and like, if you're in this situation, this is what you do, and we're here to help you, and there are treatments available, and here's what they are, and here's who they work for and when, and that has, it shouldn't all be about like hiding away from a disease all the time. People need to live their lives.
What was and now everyone's applauding China for their success. They did it by localized quarantine, like we've always done. Now, their quarantines were excessive and pretty wild, but they did it through localized quarantine, not shutting down a country because an editorial board at a newspaper was pressuring politicians to do that. Why did they even have an opinion? Why did they even have a seat at the table? They're not medical personnel. They shouldn't have been listened to.
I mean, that's a great question. There should have been many more people involved in the decision making, and shutting down an entire country all over the place all at once for such a long period of time. Of course, it didn't make sense. Of course, there's going to be harms, and you can. It's so interesting now. I was just looking at the seroprevalence data from California versus Florida. And obviously California took much more of a prolonged lockdown, masking, much stricter policies than Florida did. And the seroprevalence is slightly higher in California than Florida. And so that's another part of the issue is, the things that we were doing, they don't even seem to have worked.
Well, that's my thing, is like, if they had worked, or at least worked moderately well, I would be like, okay, we're doing stuff. But it was draconian and it didn't work, or maybe worked a tiny bit. But people were sold on this idea that thus saith the Lord, these things will keep you safe. I don't know. Anyway, let's talk about vaccine safety and what we're doing with the vaccines. To my knowledge, there have been yet no randomized controlled trials on seropositive, or at least previously infected, then vaccinated, anything. Do we know what to do with that population? And especially, what do we do with that in kids?
That is such a great question. So I've been waiting for that exact study too. I mean, and what we do know is from population-based data, and actually the best study was from the CDC and MMWR. So we have to give them credit for this study where they looked at, hospitalization rates among people who had been infected previously and then reinfected, and then looked at, whether or not there was a benefit of giving them a vaccine on top of that. And they did not find a benefit, an additional benefit to that in terms of reducing chance of being of severe disease. And so that was one study. I know that there has been another study, I believe it was out of Italy, that was similar. And in children, we don't know. We don't have that study yet in children, but we know from like Israeli data that the protection that we get from being infected previously tends to provide around 90% protection from severe diseases. Maybe more. It although it may have decreased now with Omicron, but it's at least as good, if not better, than the protection that we get from vaccination. And so, that is the big question right now: is should do the risks of the vaccination in children, which admittedly are very small, but do they outweigh the benefits of vaccinating children, especially if they're healthy, if they've already been infected?
Right.
And,
right. So you have there's a difference between somebody having a complication of an unfortunate infection that they get. It's another matter when you make a healthy child ill with a treatment, with something we do to them. That is a entirely different construct.
Yes, yeah. And I think
so
if
we're talking about
being a parent, and I think about this all the time, like how it would be very hard to deal with, like, well, the risk of the disease was very, very small if my child was already infected and then I gave them a vaccine and then there was some side effect that was serious. And again, I just want to emphasize, of course, we know that those are rare, but if it happens, then it's a harm that perhaps didn't need to happen. And we just actually, it's great that we're doing this interview today, because the preprint that we had released looking at myocarditis rates in children was just published today officially. It's been peer reviewed. It's in the European Journal of Clinical Investigation, and that was one of our arguments, that in children that are previously infected, it doesn't seem to make sense to vaccinate them when looking at the risk-benefit ratio. And it's especially strong when you're looking at giving the second dose to boys, which seems to be the one that carries the most risk for myocarditis. And of course, so our paper, we only looked at the harms of vaccination-induced myocarditis versus the chance of hospitalization in children. So we weren't looking at other vaccination harms, although those are very rare. But I think that the vaccination policy in our country needs to be more individualized, needs to be more based on what pediatricians specifically recommend for that child based on whether or not they've already been infected and their health status. And when we have mandates in this country for school or for, going to a museum or for whatever it might be, we're really forcing something on a child that might not be in their best interest. And that's a problem. That's a public health problem. And that's not happening now in Europe, or at least I can speak for Scandinavia, that they don't have the mandates for children to go to school or to go to any public places now. I know they used to have corona passports in Scandinavia, but they've dropped that because a lot of what we knew about vaccines during Delta, or what we thought to be true, has changed with Omicron. Now that the vaccines are very poor at preventing infection, asymptomatic infection, and preventing spread to other people. And the effect that the vaccines have on that wanes really quickly. And so we don't have that same justification of vaccinating children to protect others that we used to have. That protection is very small.
So here's what we know. Right. Here's what we know now. Vaccines don't prevent the illness, they don't prevent infection, and they don't prevent spread, period. Masks on a mask level don't protect anyone from one another. So all this virtue signaling is actually based on nothing, based on primitive,
that's exactly
you might
right.
as well
That's exactly right.
Throw the idol in the volcano if you want the weather to change. You might as well do that, because we're primitive man now. We're behaving like
That's
some
right.
sort of, primitive society. So there we are. Now, but vaccines have utility. I'm still very much in favor of vaccines, just done properly, done well, like any treatment. Risk-reward analysis done by the doctor for the patient. The fact that doesn't exist is just way out of line right now. What has happened is medicine has gone from being decentralized, where highly trained people with extraordinary experience are asked to make individual decisions for individual patients, to centralizing it. We cede it to a central system, bureaucracy, authority that has no business being involved between the patient and the doctor, and is not able to make good decisions and makes terrible decisions. We're talking about them right now. That's what we're into. That's the problem we're into.
That is particularly problematic for this disease and and the mRNA vaccines, because the vaccines we've seen are effective at reducing severe disease, especially in older populations. So, this disease and these vaccines really, our approach should be an individualized approach.
Yep. I told some of my 80-year-olds just today, I said, you probably going to prepare for a fourth vaccine. That's probably going to be the right thing for you. But in terms of boostering
boosting people who are older and at risk, I agree. I don't know.
Yeah. But boostering a 15-year-old? No way. No way would I booster a 15-year-old. No way. And giving a second dose to a 17-year-old male who had COVID? No way. No way would I recommend that.
That's exactly right. And like you said, we don't even know about the first dose in the 17-year-old, who had COVID. And based on booster data in the New England Journal, out of Israel, there was no detectable benefit for people under 40 in that study, because once you've had 2 doses of vaccine, your chance of hospitalization is so rare that they weren't able to detect the benefit of the boosters. Now, I don't know, that might change over time if the effect of the second vaccine, wanes against severe disease. And that's why we have to keep a close eye on the data. And again, I'll say that I look at Scandinavia and I look at Denmark for their data every day, because they're making widely available to the public about vaccine effectiveness against severe disease, hospitalization, death. The CDC is not doing that. It's not up to date. We're not getting access to that. It's frustrating.
Incredible.
We should have that.
It's just incredible. It's just incredible.
Yeah, it is. We would trust.
And then the other thing, the other thing that I find incredible is the way the pericarditis, myocarditis complication is tossed out as like, well, it's just myocarditis, it's just a mild thing. Before these vaccines, myocarditis was a freaking medical emergency. First of all, rare. You rarely saw it. And if you saw it, that person is going into the hospital right now. They could die any second with an arrhythmia. They could end up with a cardiac transplant because of a cardiomyopathy. You don't know where you're going, and it is a serious medical emergency. And people talk about like, well, one in 1,500, maybe 1 in 3,000 myocarditis. No, so what? So what? This is one of the more devastating medical problems you can have. Now, thankfully, it has been mild and tends to reverse. But let's not kid ourselves. Myocarditis is no BS.
Well, that's right. I mean, these kids, in our data set, 87% were hospitalized. According to the CDC, over 90% of these kids with myocarditis are hospitalized. They often have to miss 3 to 6 months of participating in any exercise or sports for this. There's what's called this late gadolinium enhancement on the MRI. So what I understand is there's a potential for scarring of the heart long term. These are kids that we need to follow them long term. We need to know, if there's any increased risk of problems with, arrhythmias in the future. But it's not something that you want, your child to have. And again, if it's 1 in 3,000 risk, that's what it's looking like for the 12 to 17-year-olds around there. I mean, that, it's still rare, but, considering their risk from COVID, this is something that needs to be taken seriously, needs to be looked into. I'm not a cardiologist, but I've talked to cardiologists about this, and, they're justifiably concerned about it too.
Let's be clear that having had this with the active inflammation on the MR suggests possible sudden cardiac death down the road or need for a heart transplant down the road. I mean, this is mind-boggling stuff that is tossed around as mild, no big deal. Anyway, but there's that. Let's take a little break here. I got to do a little run a couple ads here. Maybe we'll take some calls when we get back. I still have plenty more to talk about, and my goodness, there's so much more. So thank you for being here. Thank you for the research you're doing. Let's take a little break and be right back. Since the beginning of the pandemic, nearly 1 in 5 Americans has reported consuming an unhealthy amount of alcohol. Could be you, but only 10% of them are actually getting the help they need. Reframe is a neuroscience-based smartphone app that helps users cut back or quit drinking alcohol altogether. Using evidence-based tools, techniques, and content, Reframe guides users through a personalized program to help them reach their goals. Comprised of daily tasks, a comprehensive toolkit, a community forum, and accountability guides, Reframe is a modern, accessible, and affordable resource that can help anyone looking to reevaluate their relationship with alcohol. Reframe is backed by Harvard University and Emory University Schools of Medicine, and it is ranked the #1 alcohol reduction smartphone app worldwide with over 350,000 downloads. With Reframe, there's no stigma, just science, no labels, just support. To learn more, go to joinreframeapp.com/Dr. Drew. Use the code Dr. Drew for 25% off your first month or your annual subscription. That's at joinreframeapp.com/Dr. Drew. Let's talk about our friends at Hydralyte. I can't say enough about Hydralyte. You hear me talk about them all the time. It gets me through workouts and medical procedures and colonoscopies and COVID. It absolutely contributed to my recovery from COVID. Hydration is key to feeling healthy, and there's never been a time when that could be more important. We're in the height of cold, flu season. Every headache has got you testing for COVID. Staying hydrated can keep the questionable symptoms at bay, and there's nothing better than Hydralyte to get it done. Taking their hydration formula one step further, now there is Hydralyte Plus Immunity. It starts with their fast-absorbing electrolytes and adds a host of great ingredients. Plus, each single-serve, easy-pour drink mix contains 1,000 milligrams of vitamin C and 300 milligrams of elderberry extract. Hydralyte Plus Immunity comes in convenient, easy-pour powder sticks that rapidly dissolve in water to make a great-tasting drink that has a 75% less sugar than your typical sports drink. It uses all-natural flavors. It's gluten-free, dairy-free, caffeine-free, non-GMO, and even vegan. Hydrolyte Plus Immunity is also now available in ready-to-drink bottles at the Walmart next to the pharmacy, or as always, you can find it by visiting hydrolyte.com/Dr. Drew. That is HYDRALYTE.com/Dr. Drew. And be sure to use that code Dr. Drew 25 at checkout for a special discount. Oh my goodness, I'm seeing such crazy things.
I'm having my Hydrolyte right now.
Good.
I'm having the elderberry zinc. It's got zinc and vitamin C in it.
Excellent.
It's called Berry Blast. It's pretty good. Oh, and it's overflowing all over the table. So anyways, I was listening in the other room, and I'm just like so happy we have this guest on today.
Yes, indeed. By the way, for those of you in Clubhouse, if you raise your hand, we will take some calls. You can ask Dr. Høeg any questions you might have. If you do raise your hand and you do come up to the podium, you will be streaming on multiple platforms: Facebook, Twitch, Twitter, YouTube. Are we on Rumble today too? Somewhere out there?
Yep.
So,
sorry, I'm making noise.
So check that out. Yes, your chewing sounds are lovely.
Sorry, if you don't let some of the water out of the bottle, the Hydrolyte explodes like a little volcano. It'd be fun for kids.
Yeah. Don't confuse surgeons wearing masks so their snot and spit and hair do not fall into a surgical field with infection control measures. Do not confuse those two things. What else we got here that I was looking at? I've got dogs and cats flying around here.
Oh
today.
no, we have a new cat
crazy.
in the house too, and I guess the dog was fighting with the cat while
Yeah,
we were downstairs. Oh, nice.
Your husband I'm interested. Your husband being a bone marrow transplant doctor, what is his opinion on masks? Since they have to maintain such strict, both directional infection control when they have their bone marrow transplant so immune suppressed.
Yeah, I mean, he tells his patients to wear N95s, and they need to be very careful. And as far as I understand, and I've discussed this with him, he does tell people and their families to mask around them. So we've discussed this because they would have to be, I would think, wearing a high quality mask because as I think you and I both know, and I've discussed with him, that the data that we have supporting wearing cloth masks is just non-existent.
Zero.
And then
Just zero.
The data that we, the data that we have for surgical masks and based on the randomized controlled trial in Bangladesh that we have, it's like, well, maybe there was a very small reduction among older people of testing positive, but that was in the setting of increased distancing and in an unvaccinated setting. So bone marrow transplant physician or patients take a lot of precautions that they've taken in the past, with wearing N95 masks and being very cautious. And I think it was very interesting because Monica Gandhi just said something to me that struck me as very smart, because she said that COVID, it seems like we're moving to a phase of the pandemic where COVID is really a medical problem and not a societal problem. And I thought, that's a really interesting way of saying it, because it's like, I think that we're reaching, endemicity where we're identifying the individuals who are really high risk and sort of creating a very specific plan for those people. And, for people that aren't aware, when you have a bone marrow transplant, like your immune system is basically destroyed. And so you've got nothing protecting you. And so they need to get, revaccinated and everything. And so the rules, they have sort of different rules for things that, they need to protect them than the rest of us. So, but yeah, I think in terms of masks, even for influenza, we knew this, Cochrane review showed that masking was not beneficial for preventing spread of disease. And so my take on that, all along is I was wearing N95s before I was vaccinated in the clinic, and to protect myself, to protect others. And now it's just like, I don't think that we have data to suggest that masking, cloth masking, surgical masking, is really doing anything to protect ourselves or others, and probably is giving a false sense of security. I love talking about the CDC study where they looked at the outbreak in the Marin school, where all of the kids supposedly were masking with high compliance, and still when the teacher, a teacher was infected, came to school, she still infected 60% of them. And it's like, okay,
Right.
well, so, it is a false sense of security, right? So if you have a child that is extremely high risk, you're not going to rely on the kids around them masking to protect them, or them masking to, that's not really a good safeguard against infection.
Yeah, Monica also taught me that really all you can do is protect yourself with an N95. You really are not doing much for anybody else. That's what the data said. The other thing, this notion of it being a medical problem and not a social problem is very interesting. I think that's what had me so upset from the beginning, is I saw this as a medical problem from the beginning, and people made it not just a social problem but a political problem, and that's where I think it just went off the rail. If we just applied our normal measures, our normal practices, what we've always done, what we can always do well. And I knew we'd improvise. I knew we'd find treatments. I knew we'd find vaccines. I knew it. I just knew we there's all this consternation about this country's medical system and newborn fatalities and nutritional data and stuff. We got problems, but nobody does this better than us in terms of solving problems when we got to get it together and solve it. It's just the best. It just nobody comes close. All right, we'll take a couple calls here. I saw some hands up that went back down again. Josh, go ahead.
Hey, Dr. Drew. I just want to try to figure out what's going to happen the next time we have a pandemic. I know it's probably not going to happen, but the reason why I say that is because it doesn't seem that it's going to be very different, because there has to be an initial shock or awe from the government that's going to get people to at least pay attention to something.
I see what you're saying. I get what you're saying, and I've ruminated on that very point in my own quiet moments. Occasionally, I think, what do they see something that I don't see from the perspective they have, or they felt they had to do this, or would people have ignored all of this if they hadn't scared the crap out of them? But let's ask, what do you think, Tracy?
Yeah, I mean, that's something I think about a lot, because another situation like this is going to come, and I think
that's the other. You said maybe it won't. It is going to happen.
Yeah,
it's not a matter of if; it's a matter of when.
It's going to come. It's just when, and what will it be like? And I think during this pandemic, well, for one, the burden of proof basically got turned upside down, in that we're just going to keep disrupting normalcy and do things that we've never done before until we know that it doesn't work. I mean, I think that was one problem. It's like we needed to really act rapidly to figure out what of the things that we're doing are actually working, and try to maintain normalcy as much as possible while figuring that out. And I just again want to talk about how Scandinavia and especially Sweden did that. And I think that, they learned, Sweden, kept schools open, kept life. Basically, they had paid sick leave, and they, encouraged people to stay home when sick. And but they had outbreaks in the nursing homes in the very beginning of the pandemic. They recognized this problem. They figured out how to deal with that, and have had very low all-cause mortality, similar to Denmark and Norway, lower than the rest of Europe since that time. And, they really, they did a good job. And I think maybe Denmark and Norway did even better. But in terms of keeping things as normal as possible until you find out, no, we actually really do have to do something. And we're doing it because we have evidence that disrupting what we normally do is worth it. And so I hope that we change that in the future in terms of our pandemic response, and that we demand to have good data coming from the CDC that justifies, any sort of disruption of people's lives and circumstances where they could lose their jobs. And, especially when it has to do with children, cutting off their access to school and sports without, just as we've been talking about, without any justification. I mean, we need to stop that from happening again in the future.
Yep, I agree. I totally agree. Angela, do you want to make a comment?
Yes. It's nice to talk to you again, Dr. Drew. I'm the nurse from the Bay Area that had cardiac issues from the vaccine. And I appreciate you guys talking about the risks of myocarditis and how it is dangerous and it is not as mild as they talk about. But the reason why I'm here is I actually would love if you could bring Ernesto up to the stage. He should have his hand raised.
Yep.
His son passed away from myocarditis at the age of 16. Mm-hmm. And Dr. McCullough did his autopsy and confirmed his heart was twice the size. So I think it'd be great if we could share his story.
Okay. Ernesto is up. Yeah, it's what we were just talking about. These are serious conditions. These are really serious. They're unusual, but they're not super common. But when they occur, they're devastating.
Devastating.
Ernesto,
thank you.
Ernesto?
Hello, how are you doing?
Hi there. I'm so sorry about your son.
Yeah, thank you.
Awful.
I mean, yeah, I was listening in a minute ago. That's a bad thing about this. When all this started, we all thought we were doing the correct thing. They were telling us. And the only thing they ever showed us on TV was people catching COVID in the hospital, on ventilators, mm-hmm. and dying. Mm-hmm. So all they were doing, to me, that was a scare tactic. Mm-hmm. And so they could go on with this testing. Why didn't they tell us the truth from the get-go? If they would have done that, my son would still be here. I feel like they murdered my son, is what they actually did. I really believe that somebody needs to come up with and be charged and take a stand. Be a man up, and all right, you did something wrong, stand up and take it like a man. I mean, these people are never going to give me my son back. Other than I get tortured every morning when I get up. I get up because I got to keep on this fight for my son and for other children, because if I don't do it, no one will. And this is just completely wrong what they're doing, and they're still continuing on doing it. What happened to COVID now? It died away now. There's no COVID anymore, but they're still pushing this damn death sentence on everybody. Or if not that, look at little Maddie. Maddie's suffering. To me, that's child abuse, man. What are you doing to these children? We need, like I said, we need to stop this. This is a bunch of crazy stuff that's going on in the world. I mean, is it all for financial gain? I mean, really? Do they need that much money? Do they? I know that it's going into somebody's pocket, and they're not paying back, like all these friends I made, for the wrong reasons. They're not even helping them financially with medical assistance or anything. I mean, you knew you did the damage, at least help them in one way or another. That's what it's really upsetting me. And, FEMA's trying to pay me off. They called me after they denied funeral assistance. They denied me last year. And I guess with all this talking, I'm going around traveling, speaking everywhere. They called me just before Christmas, and they asked me if I would change my son's death certificate so that it read COVID and not myocarditis.
Wow.
And I told them no. And they kept bugging me for almost an hour, on and off hold. They kept asking me, please, can you do that? We're going to help you financially. I said, no, I will not disrespect my son in that way. I said, and I will not change his death certificate, falsify paperwork for financial gain. I said, please, just leave me alone. You or anyone else that's listening in, y'all want more information, Google my name. You'll find out exactly who I am and who my son is.
Ernesto, what's your last name again?
Ramirez.
All right, man. We will do that. Thank you for talking to the group here. Angela, thank you for bringing Ernesto in. Go ahead, Tracy.
Yeah, Ernesto, thank you so much for sharing your story. I'm so sorry about your son. That's really heartbreaking. And, I agree with what you're saying, in that, this is why we need transparency about the risks, the possible risks and the benefits of the vaccines in children, because parents and children need to, with their doctors, be able to make the most informed decision about vaccination possible. And I just hope that you don't blame yourself, for what happened. And, I'm just very sorry to hear about it. And I admire you for speaking up and bringing attention to it. So thank you for doing that, because I know that there have been other autopsies recently that have shown the vaccine to have been, where the vaccine was found to be the cause of death in a couple boys, and in peer-reviewed articles, a few young men, and that was related to myocarditis or heart conditions. So I, like you, have wondered why it seems like some of this is being covered up. And again, I'm not the type of person, I don't want to fearmonger about the vaccines either, because we're talking about things that are extremely, extremely rare. But at the same time, the only ethical thing to do is for us all to, public health officials to be as honest and transparent as possible about the risks, and to try and, establish how often these things happen and how serious they are, and do the benefits justify the risks? I mean, that's basic public health.
But you said this 40 minutes ago. You said it should be personalized. There should be a risk-reward analysis for every given patient, and then the doctor makes a recommendation based on that child's risk profile. 1, 2 doses, whatever. Post-infectious, maybe one, maybe not, maybe nothing, and that's it. But the fact that one size fits all here, and that kid couldn't have gone to school without his vaccine, probably. So what's he supposed to do?
Exactly
what's the dad supposed to do? Yeah, and it's just,
right. He said he wanted to take his tests. He wanted to get his,
It's too much. It's too much. And what happened to, what is it, Covaxin? Is that the vaccine? Where are these other vaccines that don't have some of these same side effect profiles? Have different side effect profiles.
I just read a Medscape article. It wasn't approved now, right? The Covaxin. So that's unfortunate. I also wish that we had alternatives that we could be looking at.
Yeah.
And it's such a virtue signaling thing too. It's like we wanted Tyrus to come and have dinner, and they wanted to bring their son. They said we can't go because he's not vaccinated, and he's like 9, Georgie, he couldn't come. And it's like, they live in New Orleans. Nobody's wearing masks anywhere, but you can't go anywhere without the vaccine. So you're trapped.
Yeah.
Yeah.
And it's based on a misunderstanding. The vaccines are preventing transmission to other people, but they're just not doing that. It's very small.
And so since when is it medically, ethically appropriate I'll just bring 2 minor issues to the fore. Not giving full consent to a patient in terms of risk benefit, teaching the patient the risk reward potential. Like, what do you do when you're going to have a surgery? You talk about all the potential bad things that can happen. Every time I give a patient a medication, I talk about all the bad things that can happen, and then say, here's why I'm suggesting, here's what'll happen if you don't take the medication, which is probably more likely to happen than these unusual side effects. So we're going to take the medication. What happened to that? What happened to informed consent? And then
I wondered too.
And then literally, and in place of that, but Tracy, in place of that, we're using coercion. We're saying you can't go to school, you can't go out, we're using coercion. When did coercion become medically appropriate? I can't. I'm in Wonderland. I'm in La La Land.
And also, just for people who are listening, who are thinking, well, what about the other, vaccine requirements for schools? Those are different. Those are vaccines that we have very well established safety on. Years of studying these vaccines, and we know that the benefits will outweigh the risks of those vaccines. And so, I myself am a proponent of, the required childhood vaccinations right now, but the situation with the COVID-19 vaccines is different.
So hang on, I have to interrupt. We know for sure that the risk benefit of taking, say, the measles vaccine definitely falls down on the side of taking the vaccine. That the rare side effects are definitely not as much of a concern than an outbreak of measles and the massive damage that, if you've never seen measles encephalitis, I welcome you to go take a look at that someday. Measles that kills kids and and massively infectious. The risk benefits clearly come down on the side of vaccinating. With COVID, there's no clear benefit to vaccinating. I don't understand why we're vaccinating certain age groups. I don't know what we're doing for a disease that doesn't hurt them. What are we doing? That's the part. Yeah. That's the part that is the problem, is it not?
Well, that's right. I mean, we're having trouble even doing a trial that's big enough, to show that the vaccine, like in the 5 to 11-year-olds, even prevents severe disease. And the data that we have out of New York, they cannot even find a significant reduction in hospitalizations for the 5 to 7-year-olds in the vaccinated versus the 5 to 11-year-olds in the vaccinated versus unvaccinated. So, it just shows you how extremely rare, especially in that age group, a severe disease is now, especially that it's 58% of kids, I guess, according to the CDC, that have now been infected with COVID. And for all of those kids, we don't know if getting vaccinated is going to benefit them, especially if they're healthy. I mean, it's really hard to understand that it would be mandated when we cannot show the benefits.
Right. And don't mistake what I'm saying about kids with the fact that I am literally every day telling my 75-year-old patients they will need a 4th booster, and I'm recommending it, and I'm going to get it for you. So it's about the appropriate application and the appropriate risk situation. I've had the vaccine, not sure it was worth it. Susan had the vaccine. I think she needed it. My kids have all been vaccinated. I think it was, one of them had a terrible reaction, and one of them already had COVID.
They got sick from it.
I'm not sure he needed it, but our daughter very much benefited from it. So it's about getting the right patient, the right treatment to the right patient. I don't want to use the word treatment with vaccine because people get all spun about that, but giving the right medical intervention to the right patient. And that's what medicine is. That's what it is. And we're not doing it. And so poor Ernesto ends up with a catastrophe with a son that would have never
that they're trying to
COVID.
Sweep under the carpet.
Well, that's his
when
story.
Does FEMA call you?
I hope, Ernesto, you go to the press or somebody to figure out what
insane.
that was, that when they were trying to coerce you again. Please go public with that.
Oh, I would have gotten an attorney.
But again, don't mistake, saying a vaccine works and it's a good thing, I'm so glad we have it, with it being used in all situations coercively no matter what. That's not what I'm saying. I'm saying given to the right person at the right time.
It's going to erode trust of people, in vaccines in general, if we start forcing a vaccine that might not be beneficial.
It's true. And kids are supposed to get snotty noses and be sick and pass it around to everybody. If you have your vaccine, you're not going to die from it, but your kids are supposed to get sick. I mean, they were sick all the time, and then that's how you get an immune system. Now they're all afraid to go outside in the sunshine.
Well, it's going to be interesting. Where do you think this, let me ask my last question to you, Dr. Høeg. Where is this going to shake out? Is the truth going to come out in some sort of retrospective analysis that becomes a famous book, or is it going to be in a series of court cases that take this on, and Ernesto gets a chance to have a day in court to really, change the laws, or it's going to be legislative?
Things, right? There'll be lawsuits. There'll be people writing articles and op-eds about their stories. There'll be more research articles, and scientific journals will be less hesitant to, I guess, publish, evidence and truthful evidence about what's going on, and so I think, as we probably saw with the school closing issue, I mean, obviously this is a new issue, but probably a year or so down the road, we're going to look back and we're going to say, myocarditis, it was a real thing, it was a real issue. We should have run larger trials, and especially in the child age group, and we should have done what we could to minimize harm. We probably shouldn't have vaccinated, the 18 to 30-year-olds with the Moderna, probably Pfizer only, since the risk of myocarditis is higher with Moderna. Probably shouldn't have done boosters, at least not immediately in the youngest age group without, evidence of benefit. And I think a lot of that's going to shake out. It doesn't happen fast enough. And that's the problem especially when you authorize vaccines under emergency use, that, you don't know all the risks and benefits then, because the trials are too small. And so, I think that we need to, because of that, learn more slowly over time, and the truth will come out. But it just, there will be harm that's been done that was not necessary.
Yes, exactly. I think that's the bottom line right there. Ernesto, please give us an email, if you wouldn't mind, at contact@drdrew.com. Contact@drdrew.com. We'd like to talk to you some more if possible. And Angela, maybe you too.
I'm going to make a clip of his interview.
Okay. And I'd like to know more about...
and then we'll send it to him. And then we'll send it to wherever.
Yeah, I just don't know more about that whole story. That's kind of crazy.
It's insanity.
Yeah.
Did you see that? I just sent you this thing that I saw in the middle of the night.
You texted me
It's
something?
coming around the other side.
I know.
I was up in the middle of the night with the lightning and worrying about my renter and her son and all this stuff. And I went online and I saw this and I took a screenshot of it.
I think you're getting it wrong. This is not what we've been talking about.
No, I know, but this is where it's going again. It's going back in that direction.
I know it is. I know.
The truth has to come out before
So what Susan is talking about is there seems to be a concerted effort to put the source of the virus back in the Wuhan wet markets. Just at the same time.
So it's getting political again.
And I did an interview. Well, I have an interview. I've got the guy's info right. I did an interview with a guy that wrote a book. Oh shoot, called The Origins of COVID or something. He's a Viscount in the House of Commons or the House of Lords. And he wrote it with an MIT virologist. It was really interesting talking to them. And he's not saying categorically this is what happened, but he particularly the issue of the fearing cleavage phenomenon in the virus. Apparently that is a extremely common lab manipulation. And they sort of chronicle how that was being put into certain viruses that were very closely related to COVID-19. And so it's sort of a whodunit that I don't remember the name of the book. I think it's The Origin of COVID-19. Well, I'll look it up before we all say
Yeah, but what is up with this clickbait that they're putting out again? It's the panic porn people. I'm going to find this writer and I'm going to
make me talk to him.
I'm pissed. I was like, oh no. Because it was in the middle of the night. There wasn't anything about the war going on because, Now
at least I know now why I wasn't sleeping so well last night.
Do not look at the click porn at 1 a.m. I couldn't believe it. It says striking new evidence points to seafood market in Wuhan as pandemic origin point. Oh, come on.
It's
from
called
NPR.
It's called viral.
That about the fury and cleavage site, I understand that is typical. That is the gain of function research that they were doing at the Wuhan lab. And I want to recommend, Megyn Kelly has done some amazing coverage of the possibility of the lab leak, and I don't claim to have the answers to that, but it really opened up my eyes to it's a distinct possibility. Yeah.
Yeah, and not saying we know best. We're saying, man, you keep thinking about this. It's Matt Ridley and Alina Chan, and of course they were strung up for daring to have this conversation, but. Let's just keep the data going and keep looking at it. But there does seem to be a sort of an energy recently to try to push the alternative narrative. Maybe, I don't know why. I don't know. I don't know anything anymore. I can't trust anything. I don't know anything. I just try to get as close as I can to something that looks like something I can recognize as the truth. So we'll see. All right. Let's see what this says. It's amazing how many things were treated as misinformation has turned out to be truth. Yes, Janet, that is very true. The term of misinformation itself has sort of been very badly misused. It's been a cudgel that has not been. It literally would be as if you and I were in a grand rounds and we started, yelling at each other across the room, disagreeing about some therapeutic intervention. and you immediately in the middle of that said, that is misinformation, that you're allowing these other doctors to hear this. Close your ears immediately because that opinion is misinformation. No, we never did that. I don't know where that
I
came
do
from.
want to say that on June 10th, I tweeted about myocarditis and how we actually didn't know if the benefits of the vaccination in boys were going to outweigh the risks, given what we know about the rate of myocarditis from Israel at that time. And my tweet was censored. And it ended up being,
of course.
as misinformation. So, now it's 10 months later, and I don't think it would be misinformation anymore. And I don't think it was then because we didn't know.
Yeah.
It changes so quickly.
Go back to the syringomyelia and the spina bifida patients and the reconstructive surgeries that you must have to see every day. Is that sort of your zone, or is it trauma?
So I guess my zone is that I see sports injuries, I see spine, back pain, and I see spinal cord injuries. So a lot of functional problems. I just do outpatient medicine, and then I do interventional spine procedures. So that sort of stuff.
Epidurals and the like.
Epidurals, you got it. Facets, yep.
Yeah. Good times. Well, listen, thanks for spending a little time with us. Where would you like people to follow you? I've got Tracy Beth Høeg, Hoeg, on Twitter. Is that the best place?
Yeah, that's the best place. That's pretty much where I am on social media because it's too hard to keep up with all the other accounts, I guess. So
I get it. All right. Well, thank you so much. And good luck with 4 kids. My goodness.
Oh, my God. I'm so sorry.
I know.
It's been great talking with you. This has really been a good conversation.
I thought triplets were bad. 4 is too many.
You as well. Thank you so much.
And hopefully we get. So they're step kids, so they're pretty independent.
We have 3 29-year-old triplets living with us right now, so don't feel bad.
Oh wow!
Yeah,
that's fun.
Yeah.
I feel like I'm on Noah's Ark too, with the cats and the dogs.
All right. Well, thanks so much, and hopefully we'll talk soon. Take care.
Thank you. It was great.
Bye-bye. You bet.
Bye.
So I suppose we should talk to Viscount Ridley at some point. I guess I didn't realize how the guy that wrote that book, I didn't realize how vilified he was becoming, and it's kind of crazy. It's almost how you can tell that somebody's getting close to the truth. The more they're sort of called misinformation. The reality is that's my instinct all through this last year and a half is when somebody is called misinformation, my immediate instinct is I need to ask that person more questions and see what that is, because there's probably something real there.
Probably.
As soon as it's called misinformation. So
what do you think about this wet market BS?
I don't know that.
I was like shocked to read that at 2 a.m. There was nothing else there. But
I know what that data is. In fact, I discussed it with the Viscount, that specific story, and it was very weak, and he dismantled it pretty quickly. But again, people need to keep looking for the source. I have no problem with people, contemplating that it could come from one thing or another. But to announce that they have the answer to anything is a gigantic error. That's misinformation.
Yeah. And why not both?
Evidence,
they're in the same town.
Yeah.
I know.
It is.
Yeah, right. They're right around the corner.
Do not call either misinformation. Do not follow. Just allow all the information to spill forth. Eventually, we'll get to the truth.
I see it as a political move.
The fact that it has become sort of energized again is wildly weird, and
I think it's fake news coming from the Chinese side.
Maybe, or people want to be
right. Just like
right.
you get the fake news about the war from the Russian side. It's politically moving again. Let's draw attention over to this now and get all the people who don't know about science and don't believe that it came from a lab, and let's get them on our side, and then we'll get over. It's just a political move.
What's interesting to me is you weren't as sort of sensitive and worked up when you sensed politically motivated press, but now you're sort of tuned into it, and it's affecting you.
No, it's coming back. It's coming back full force. You just don't know which side to look at, and don't believe everything you read. That's all I can say.
That's a good note. And we'll be back on Monday. Are we doing a special time? Did I hear 2:00?
I think we're going to aim for 2:30, so Paulina can pop by, and then
2:30.
I'm trying to see if I want to see if Leopold can come on Monday, because he gets to ask you questions. He won the bobblehead contest. Show everybody the bobblehead. That's your
Leopold gets his time in the sun.
Show everybody.
Sorry, Susan's like calling.
You're the worst salesman.
Yeah, I know. I don't like selling things. I do not like it.
But it's so cute. And
we sold a couple. We asked the Insane Clown Posse if we could make a couple for them, and that was excited them a great deal.
Yeah, well, I don't know. We'll see if that happens. Let's just sell ours. But anyways, in the meantime, we're gonna try to just lighten it up a little bit.
Right now?
On Monday.
On Monday, okay. And then on Tuesday,
we'll let Leopold pick the subject matter for the
Tuesday. We're going to do a lot of calls.
If it's
hopefully.
Leopold or Harley, it was a tie. I don't know if Leopold's still on here.
The Lynch disorder, Lynch syndrome discussion on Tuesday is going to be more about why you need to make sure you check your genetic heritage. There's ways to do that, and we'll talk about it. All right, everybody, we'll see you on Friday. Thank you, Caleb. Thank you, Susan, and we'll see you then.
You're welcome.
Ask Dr. Drew is produced by Caleb Nation and Susan Pinsky. As a reminder, the discussions here are not a substitute for medical care, diagnosis, or treatment. This show is intended for educational and informational purposes only. I am a licensed physician, but I am not a replacement for your personal doctor, and I am not practicing medicine here. Always remember that our understanding of medicine and science is constantly evolving. Though my opinion is based on the information that is available to me today, some of the contents of this show could be outdated in the future. Be sure to check with trusted resources in case any of the information has been updated since this was published. If you or someone you know is in immediate danger, don't call me, call 911. If you're feeling hopeless or suicidal, call the National Suicide Prevention Lifeline at 800-273-8255. You can find more of my recommended organizations and helpful resources at drdrew.com/help.